Spondylosis, as I said, those stretches of the spine, very popular these days because it leads to what is called sciatica. Sciatica is getting popular because it leads to that waist pain that sends electric shock, as if shock is firing somebody down the leg. You understand? That, so that the leg will be like as if it's not the person's leg anymore. They see the person walking like this. You understand? Sometimes, because of the confidence, the person thought that there was still current going here. The person pulls his leg forward, no NEPA is taking lights, wow, on the floor. Some people fall in the market, yes, because of sciatica. That's because of osteoarthritis of the spine, also known as by baptismal name called age-related degenerative disc disease, aka DDD or spondylosis. I say a lot of this often. We have septic arthritis, infection of joints, we have reactive arthritis. Who has got an Indian feel? Where something may happen somewhere, and one woman that nothing concerned, I got to basketball to be shouting, Nehi. That is what is happening here. Infection is happening somewhere that does not concern the knee, and the knee is getting inflamed, shouting Nehi. What concerns the knee with the infection happening on the back when the God can tell us? So that's why we call it reactive arthritis. Reactive means no concern. Then we have lupus. We'll talk about that shortly. Some people having something like a butterfly flush here. They did not rub that thing when they normally rub that. Is it rose red or what they call that? Rouge. It will not be like this. You think the person rub permanent rouge here? It's not rouge. The person is having SM. It's butterfly shaped often. Maybe on some other time we talk about it. But it's common. Wonderful. All God cannot do does not exist. That's what I was talking about just now. You see the butterfly shape on the lady's face. So this is what it's about. It's called systemic lupus erythematosus. So what are the signs and symptoms? All the animals and the knife and everything around the pain is already telling us what the person is going to. Right? Good. Stiffness and all that. This brown that is modeling for osteoarthritis is not actually happening. It's actually modeling the pain, and as you can see, the clock is telling you that this bone has some time before it finally gets eroded. And the bones are not there telling you that the mechanical activity is damaging it. Okay? And you can see that there's pain, a decreased range of motion, there's crepitus, there's joint locking. Please and please, nobody said put something on the floor for you to match the osteoarthritis. So almost like they're going to their family, I match something. What's the name of that thing? You know those films, they will show somebody will step on something, thunder will not fire, and start somebody, hey! It's just sciatica. You didn't step on it. Your uncle in the village is not trying to steal your father's land. It's sciatica. So let's go look for a scientific explanation before we conclude. But let's bear in mind that osteoarthritis is terrible because it gets worse. It doesn't stop getting worse. Once you don't address the thing that's possible, it will get bad until the person finally loses that functionality of that joint. That is why it's called degenerative. Now we have rheumatoid arthritis. You can see these are also the symptoms. When you see some people's hands, like all those witches, those movies we used to watch, those witches actually have rheumatoid arthritis. Then gout arthritis, you can see that man holding his stool, shouting, my leg, oh. You don't have to be told. Remember I mentioned that uric acid crystals are gathering there, and they are shaped like pins. Imagine me putting a pin on the chair you're sitting down, will you be comfortable? Now imagine lodging thousands of pins inside your joint. That is what they feel like. As they move, the pins are moving and shaking around and causing pain. These are the causes and risk factors. Remember I said it's age-related degenerative joint disease. That's the baptismal name, but normally don't shorten into osteoarthritis. But we call it his nickname or guide name OA. Everybody has, some people's names are so long, only has a what's the name, Akos. to go in. Then these are possible, but there's something I want to point out. Do you know that diabetes can lead to arthritis? Who is aware? But who has noticed that when people have malaria sometimes, they also have arthritis? Joint pain. That's not the symptom for people that have. You can see menopause there representing the team. They will have female gender because some women, in fact, if you want to represent an old woman in place like moonlight, you know that's what they do. My daughter is arthritis with me. Arthritis is so common among women because of the drop in estrogen. Does that make sense? Yes. Obesity. Remember that the weight of the regular physiological man is 70 kilograms. So a lot of us have been carrying one bag of cement on our head for long without knowing, because you still people doing 125, 135. So people give an excuse. So let's say that they cannot stop eating. They say everybody in my family is like, even in my whole village, everyone is fat. Even the goat. Yes, I need to see that goat. It's not fat. That's how they are in that village. Because they don't want to leave cold stone. They want to hold on to cold stone and chicken republic as if they are holding a life on this. Now you can see genetics too. Yes, genetic predisposition is not genetic sentence, just an excuse. My mother is fat, my father is fat, grandfather is fat, grandmother is fat, all of them are fat, that's why I'm fat, and is holding the family size shampoo. Yeah, what you do? Unto. Lack of exercise, when you can exercise, you say they are life. If you don't exercise and kill, they say shoot. You can't do it. So it's very bad because you need to burn up energy. You just go to the doctordrugz and you see what I talked about obesity and how to reverse obesity. I need to say malnutrition, professional weight management, leg damage because of the sciatic leg that can get damaged, loss of muscle strength, because if you're not using that leg, the muscle begins to bleed out. That's why if one leg is longer than the other. If you don't see, they were not born that way. Okay, rheumatoid arthritis, of course, you see cigarette smoking. Who are those little married there? That's Sebastian, little married. People like eating Sebastian a lot, and that can cause gouty arthritis. Seafood. Then you can see the meat. Some people like drinking alcohol. This guy has drunk alcohol to the extent that there's no need for him to drink it. He's not living inside the box more, so he doesn't have to go and get more. So I'm just summarizing. This is how we diagnose these things. Because of the medical history. Some people are very uncooperative. When you ask them medical history, you wondering, why is this man not mind the business? Oh, I have arthritis and treatment. What's your weight? Rose, I just happy, but we need to know these things because these are things that can help us to treatment. Then, of course, MRI, and all this is to see the damage through the, I'll call MRI Superman vision because it can see through the skin and all that. Then we have to use a joint field analysis. That's to rule out other conditions like gouty arthritis and more. Then for rheumatoid arthritis, rheumatoid factor, we don't call celiac protein, what we call erythrocyte sedimentation rate, and etc., and all that. So this for gouty arthritis as well. Antigen acid levels, check for crystals in the joints and a lot of other things like that. So these are the complications of arthritis. Number one, chronic pain and what? Immobility. Destruction of connective tissue that attach muscle to bone and hold it. Sometimes some arthritis gets so bad that some people need what is called knee replacement surgery. But just to digress a little, there is a surgery that I call, I'm not saying it is, but I call that surgery a medical scan. You know why? The name of this surgery is called 50-50 surgery. When people have lumbar spondylosis, that surgery is one of the most unsuccessful surgeries on earth. In fact, the name has told you. That means, as I enter they will tell you first of all that look, you have a 50% chance of being paralyzed when you sign here. Then you now struggle with the remaining 50% to know that you survive the surgery or not. It's so unsuccessful that it is better to understand that prevention is better than early detection. Before we say prevention is better than cure, don't even have anything to cure. Let it not exist in the first place. Then the next is what? Poverty and economic challenges. Because you need to buy this medication. If one, in fact, tomato and apple are not struggling for, tomato and apple are now fighting, seriously. Because one tomato, 300 naira, 250. I don't know whether I'm alone in this place. Am I correct?
You're very correct.
I heard you. I don't want that. They told me. Are they correct? It's coming down. Are you serious?
Yes.
You get it? So it's so surprising that when you go to some places now, they are ready to put red dye inside their street. So you pay the cost less. Now, what are the economic challenges? You can sue if tomatoes are expensive. How much more drugs that need to be made, processed, researched? Tomato just throw it there. In fact, some people even pepper. Some people can even eat. Some people eat their head or something. So what I say that somebody ate too much pepper in the should defecate behind your house. Pepper will start growing there. So you can even grow without stress, but it's costly. Organ damage and failure. You know that because of the kidney stones, the kidney can get damaged. Because of the sciatic nerve too can get damaged, damaging all the organs or the muscle tissue that supply damage can go there. Then we have sciatica present. Insomnia, who can sleep with pain, even ordinary heartbreak, so you can understand how much more the body is even breaking inside their body. Then peptic ulcer disease, as we are chewing our analgesics and enjoying them like chin-chin, please let us remember that they cause peptic ulcer disease. Apart from the fact that paracetamol is an assassin of liver cells, paracetamol is one of the greatest killers, one of the greatest scams on earth. Paracetamol. It is poison. I'm telling you, if you want to shut down the liver in the lab, of an animal in the lab, just give the animal paracetamol and go and sit down. After some time, go back, liver has shut down. That's what people are chewing. So they will only tell you, take 2 to 3 tablets 3 times daily. If symptoms persist, contact your. So that they will be happy. They say, I don't tell you now, I don't give you poison. I'm not take the poison as I tell you. So that you cannot take anything to court. That's why they're giving that tablet. It's poisonous. So be careful. Then they have the ibuprofen and Oga Patapata, ambassador of Bosa, the ibuprofen is also the depression and suicidal tendency. We know why. Paralysis and finally death. So what are the challenges involved in management? Delayed diagnosis, poor compliance. Sometimes you have to explain to people over and over again. If you write 2-3 times a day, the person comes to me, hey, my back, my body is aching me, I'm dying, what happened? I took 23 yesterday. I said, no, today it's 2-3 times a day. You need to understand you don't know how to comply. If you put 2 times a person can take 22. Some people will do it, they will listen. It's still, let me just take it, they say I should do it. You just drink it. You have to start doing what they call gastric lavage. Then you now see laziness, old age, because you know it's age related, that's the baptismal name. The full name is age related hereditary joint disease. So as people get older, they have higher tendency. But guess what? Age is not a disease. It only means what? Maintenance. If you maintain yourself, you may never get old. Fake medication, that's another problem. Because of what? Dollar increase. Even that man has left because of dollar increase. What dollar increase cannot do? Is there? Are you there?
He wants to go down.
He wants to go where?
Yeah.
He wants to go down. Please, people should go and tell him that what God cannot do. Now, we have poverty. Poverty is a disease of diseases. Then we have other health conditions like diabetes. So you are treating diabetes. Work-related or social obligations. You know those people in church, but they will be going around and around the church. You will not see that one place. What will you not send them? You see them, they say, if this Reverend Father should have come by now, concern, sit down in church. They go everywhere and stress their joint, and later they come and say that. Old habits die hard. Trust me. That's what they say. A fool at 40 is a fool. Because they want to smoke, sweet tooth, they always want to eat. So people are overweight, they're eating more and they're crying. Then we have self-medication, lack of specialized health practitioners. It's also another problem as well. Understand? So those are the things that we should do. Okay? We have economic challenges and high cost of what? Treatment. So that's it. So these are how we manage and treat arthritis. Wait, because we can't manage it. Balanced diet. Avoid urine foods like arthritis, physiotherapy. Not say you should go and meet people that are jumping on your back and doing skipping rope, or playing pendant on your back, name of massage, they will destroy their joints. Then we have exercising properly. Don't exercise after the problem has started. Where were you when the problem has not started? Please start exercising.
No.
You do your 10,000 steps.
No.
It's not when they now told you that, okay, one of your legs that will shoot you, the other one leg that first time. That's it, what is happening to you? What exercise are you doing now? You didn't do it when you run around the whole of shoe. Now you want to do exercise when they told you that one leg is as ocean, the other leg is as first time. How will you do it? So do it early, and the leg will be early. Therapy, of course, some people either need because of cold. Avoid sugary foods. Who is aware that sugar makes collagen brittle? Sugar breaks collagen into pieces. That's why when you see people that eat excessive junk or refined carbohydrates, they look older. Go and find out. If you are a Christian here, remember what they said when the banquet of the king was placed before Sheraton and they were eating fruits and vegetables and rejected it. Then the magicians and the others were busy swimming and whining and dying in all sorts of enjoyable things. And when they presented themselves before the king, who was fresher? Because their collagen fiber dey chicken. But those other magicians, they used sugar and all sorts of things to destroy the energy that they came back and were looking like, I don't know if the balance is no person. Drink water. Remember that your joints need to be hydrated. If not, when you are moving, your joints will sound like what? An old dog that have been not moved for 200 years. Coming down from bed, your knee, you need to wait for your knee to wake up after you wake up. So you ask some people, when they come down from the bed, their leg is in like this. You will now wait. When you see that like this, when you come out for prayer, I'm coming, I'm still downloading. They are downloading their Yes, so people are they download their leg first. When this one is fully downloaded, they now check this one, 98, 9900. I'm coming. Because of the spirit, they don't believe in that word. You need to rest and then surgery. This rest matter, after isn't like that brother there. They used to warn me every time because I'm a chronic workaholic. Anybody that knows me knows that I work almost 24 hours. But these days, I'm trying to listen to his advice, and these days I try to rest. I don't rest. I think I inherited that gene from our mom. I don't rest. So that rest is also because we need to learn how to rest. I need to learn, and I need a school. Who knows a school where you teach people how to rest? I need to go and enroll. But I'm working on it now. Look at the 50-50 surgery we're talking about. That's in there. That is one of what I call mental cancer. I asked the question one day. I said, show me one person that has done this surgery. That after 5 years, the person don't complain. Nobody. Nobody. I have a lot of patients that they will tell you that when one doctor is preparing them for that surgery, their uncle as a doctor in US will say, don't do it. Quite confirm. This surgery is one of the most successful surgeries on earth. Now we have to also know that the use of natural pharmaceuticals to adequately prevent, manage, and or reverse arthritis. That is one of the surest ways. If you want to survive arthritis, don't start when the chips are down. You know, menopause is like a tsunami or a hurricane. You know that after the hurricane passes, you know who used water in his house and who used wood. Am I correct? Those that use, if you go to areas like California and all this, no, Texas, I think this, just go there, they already do, those that use wood, after the hurricane, they come out from their residence and they start building their houses all over the streets, right? Then those that use block, the house will stand. Don't wait until menopause has come as a tsunami or a hurricane. Then when they are now 55, after the menopause has shown you shit, you start making your pieces together. Don't do that. You just have to start early to use natural pharmaceuticals to reinforce yourself. So, natural pharmaceuticals are supplements. Sorry. Now, for chemical intervention, because I always, as a professional, we are opportunity to have access to those chemicals. Of course, we use corticosteroid injection. Be aware that steroids destroy collagen. Always look at the injection in the knee or a epidural injection in the back. They are scammed you. It will never work. Before the doctor or the professional gives you the injection, ask the person who have given me this injection before and it was successful. If you know anybody, please, my number, just remember my number from anywhere and tell me the person. Let me call the person, ask the person. It never works. Most relaxants are often given like cedar wood, you know, and all that. But unfortunately, if you take cedar wood, you can't drive or do anything. Then we have those inflammatory drugs or ambassadors for peptic ulcer disease, that's what I call them. Corticosteroids as well. Opioid analgesics can make someone high. That's why they take tramadol. Tramadol is just like another form of opioid analgesic, acts on the same and kappa receptors, just as you have, you understand. The word opioid comes from opium. Opium is what some Indians smoke to get high. That is why they are addictive. You know, people take tramadol with defects. Penicillin injection, you cannot do without it. The pain has gone, but they need it. What are you needing it for? Kindness. Anticonvulsants, of course. So people are always chewing, oh, I don't know if they have gabapentin and pregabalin. What's the of this? You know what I mean? Has it ever worked for you? Don't lie. It's not after 1 or 2 days it will come back. My brother, you're a cash cow. A cash cow is what people, steady source of income, that's what you have. We give you today, you will say, it's not good. This guy. Say my name now. Thank you. Don't ask the person. Come back to using that. Person I was not using for 15. Ask them to come back. No, I don't graduate. I will stick a carry on to give higher news. Don't stick less than a thousand. You will keep going and coming because these chemical drugs are designed for you to comfortably feel. That is the truth. In fact, there are so many disease conditions that are preventable or treatable, or you will hear that they are good. Okay, is hypertension treatable? They are afraid to answer because you all know that you have heard that it is not treatable, but it is a lie. Hypertension is a lifestyle disease and it is highly treatable. But if I tell you that it's treatable, I will need to announce over we now buy the hypertension medication. Go to Google, in a corner in Google, type DASH and type hypertension. You will see it will write dietary approach to stop hypertension. Then under it will write the ways to treat hypertension. It's a book there, but you find it at the back here. That place you keep the jerrycan used to feed jelly. You know, in your house, you know that place generator is. That's where you see the book. It will never be in front. Because people that make hypertension will never allow it. It is there. I used to have hypertension, but I don't have anymore. So, as I keep recovering, they are aware that it is doing something for me. Tell the doctor says to me, better solve what is causing that problem than to take what is masking it. It's just like cleaning the car or checking the engine. Where are you going to? You understand? The car will look nice, but the engine is down. That is what we ever need to do for you. Then we have steroids and antidepressants and all that. The worst antidepressants, they sound nice. We have tricyclic antidepressants. We have all that. We have the ones that have I want to speak here. But at the end of the day, if you withdraw them carelessly, suicidal tendency. And a lot of them. Common side effects. Look at this one, they call ambassador for ulcer. Non-steroidal, that's ibuprofen and diclofenac. That's it there. Look at the disease-modifying agents against hematologic diseases, DMARDs. We have them that will cause hypertension, high problem, everything. This is the place you never see on adverts. As it says, look at it closely. Snap it, go home, Google it, you will see that they are there, but you will never see anybody say, what's that advert again? You will simply come and say, I kiss it. Also for you, beautiful for you. You ask them say, but it can kill you. Never let that from. Never. You say, give to your father, give to your mother, share the love I kiss it all. At the end of the day, it is poison. So, all drugs are poison. But sometimes they are taken to prevent us from what? They have shield us from immediate danger. That's the truth. But not to be taken forever. So that's why they have to be used with strict professional guidance. Do you understand? So let's go to natural pharmaceuticals because this one don't have side effects. Before they say they were expensive, but now everything is augmenting the other 18,000 for one. You understand? Yes. So people are now running back to nature again. That's why natural pharmaceuticals are important. And that's why oftentimes when I want to treat something, when I do treatment for something like pentecost disease, the pentecost disease now we have ties daily and that's actually it has to do that follow it. Before, if you give someone that has pentecost disease like ulcer kit, it's gone. But I'm telling you, we have been treating ulcer for the past 5 years, it has not gone. Because the parasite has not happened. Now it is more fortified. The drug that you eat is on the time they're waiting to eat it. Because it is what there's something resistant to it. So what we do, we can support with natural pharmaceuticals like propolis and all that. And bacteria has one way to go to. And that's how I have 100% cure rate of pentecost disease. 1 month is what is the needs. You run the natural pharmaceutical on this side, and you run the cultural reduction therapy on this side. So now how do these natural pharmaceuticals help the management of arthritis? They reduce inflammation, regulate immune function, and a whole lot of other things that we do. Can see that because of time, we'll be able to do that. So I want to show some examples of active ingredients. Now let's focus on the active ingredients in these things. Because you may have what you are using, but this is what I use for my patients and I've got to good results. So look at the active ingredients. If you have another source where you can get these active ingredients, fine. But this is what I have used for patients and I have got to good results. So here you can see that it contains converted glucosamine, methylsulfonate, maintain and all that. Because of the time we can't go on this. Make sure I invited you to show more light. This one contains a whole lot of things, which includes converted glucosamine, methylsulfonate, maintain, collagen, but just everything you need in the joint. In fact, the name is move, so you should know what it means. Anti-stiffness. And then this all contains very powerful antioxidants against free radicals and DNA damage. The This is for immune, this is immune blend. This is regulatory for the autoimmune ones like the spondylitis and the rheumatoid arthritis. You can see we have dicalcium manganate. We have calcium, but you know calcium is water soluble. So when you are drinking your calcium, as it's entering here, it's coming out through urine. But this is dicalcium manganate, so it stays longer in the blood. Then we have the icosapentaenoic acid, the anti-inflammatory. You see, we're talking about pain reliever, painkillers, painkillers, but we need to have alternatives. This is an alternative, okay? We still have what they call atrapinones, found in that one in yellow bottle. It's also an analgesic, but it doesn't cause ulcer as well. So you can support, at least, to reduce the dose of those ulcer-causing ones. You understand? As well as giving you what you need. We will have the grease of the joints, hyaluronic acid. This one contains a lot of things. We have B12 plus, which contains cobalamin analogs and folate analogs for people that have sciatica. To heal the nerves. When I say do not massage, this is what you can apply in the daytime because of it's hot. Then you apply between brother in the night time because it is not hot. Then when I talk about collagen being abundant in joints, you can see that there. Then we talked about weight management. This is a weight management package. We have the Garcinia Plus, which contains hydroxycitric acid, a novel molecule that prevents conversion of carbohydrates to fats. Then we have thermogenic substances in what they call TEM that helps to burn fats. Then we have lean. Lean contains chromium trichloride, which helps to metabolize fats. Remember that the definition of obesity, forget all the grammar, is simply defined as excessive detrimental accumulation of body fat. Obesity is a function of body fat. That's what it is. That is scientific definition. So if you are losing weight, you are losing what? Fat. But when you are losing weight and you are shrinking your cells and making them unhealthy as in malnourishment, so we say, I drink ginger and tea every day, which is good. But after drinking ginger and tea, you have balance with one mountain of eba. And follow up with better food. And you bless it with chicken, turkey, everything. Make sure you know around what to go, and then you finish it. Or you say, I'm watching my weight indeed. You put your weight as a future and you're watching it because you're not going anywhere. Then you can see this the 9 days weight loss and detoxification program that contains everything. And you see, the advantage of this program is that it inculcates what is called intermittent fasting. The reason why a lot of people are not doing the truth in the hospital is that we can't handle it. You know, so when you tell a woman that is fat, that she's fat, she can't pass with that. She can't even like this. I'm not fat though. Never. You know how I was doing before? Me and I get fat there, we are neighbors. We're the same size. I'm telling you, they will never agree. But it is your weight and your height that will bring us whether you are fat. As far as I'm concerned, I'm borderline. I used to be fat because I was heavy man 20 kilograms. I'm 6'2". My body mass index was high. But now that I'm around 100 and I'm 6'2", you can see that I'm actually around borderline. Or basically about it. But we have obesity 1, obesity 2, obesity 3. But some people are obesity to be continued because we learn the scale. You will climb scale. And the scale will not rest in peace. That's why you go to hospital sometimes, you put them at the back. And I made this room now. Please come. I came in front of them, hold on, so you're busy. Because you know, she climbs the scale. That's finished now. The scale can just rent out like me. Because they have finished the scale. So we need to help ourselves. So this program, you can run every 3 months. But there's a tweak. When you run in 9 days, there's something I call locking in your weight. So that time we'll have that seminar. I'll teach us how to lose weight and stay that way. Somebody saw me the other day and said, Loki, what's happening? Where's your mommy? Where's your mom? He said, where's your stomach? My stomach complication. It's not coming. So these are the tricks we scientists use So while we're eating with you, we run back home and we pop these things. And we're okay. While you're at home, you're believing that we're in the same page. So this is actually what we're supposed to talk about together with type 2 diabetes. But because of next time, we'll talk about type 2 diabetes. So this is very important. You are what you consume, and there's a constant battle between factors that repair and those that function that break it down. So we have to be on the winning side. So there's a constant battle between factors that destroy our bodies and protect our bodies. So we have to be on the winning side. And then do not adjust medication and moving that together to drink about sugars. Remember that these natural pharmaceuticals are like important aspects of food that have been extracted to help us attain the body. We are not saying that you should abandon your health practitioners lecture, okay? So you must have to be. So afterwards, don't have any questions for me or want to see me privately. So aging is not a disease, thank you for maintenance, thank you for coming. God bless.
Thank you, sir.